Hello and welcome to today's special edition of In Conversation brought to you by T7. I am your host, Evangeline Thubru, and I'm delighted to have with us today an esteemed doctor in the field of obstetric and gynecology, Dr. Jutimala Bhattacharyya, where we will be diving into the complex and often sensitive topic of IVF. So hello, doctor. Welcome. Welcome to the show.
Hello. Thank you for inviting me. Thanks so much.
For being with us today. Okay, so doctor, I would like you to, before we go ahead with the program, would please introduce yourself.
Hello, everyone. I am Dr. Jutimala Bhattacharyya. I am the Chief IVF Consultant at Arbor IVF and Fertility Clinic, which is located in Guwahati. And I am an IVF specialist trained in reproductive medicine. And I have been practicing this subject for the last almost 15 years. And this initiative that you have taken, we are very happy to be a part of it, just to reach out to the people of Meghalaya and the entire Northeast to create an awareness about what infertility is and what is IVF, to break certain myths. That is the whole objective of this program. Thank you for having me.
Okay, so doctor, I would, before we go in deeper with IVF and what it's all about, can you just please give me a brief description of what does it look like when it comes to statistics in the case of India or Northeast as a whole?
Yeah, nowadays we have seen that infertility in Northeast India, and not to say just about Northeast India, but the entire country, the rate of infertility is on the rise. We have seen that 1 in 7 couples are suffering from this problem of infertility, having trouble in conceiving. So it's quite a serious problem, quite a big social problem at the moment that we are getting to see. And if you ask about why is it on the rise, we have seen couples, they are more, after they get married, they are more inclined towards establishing them professionally and then trying to go the family way, which can delay the time to conception. And we have seen that after 30s, for both the male and the female partner, it has been seen that it becomes difficult to get pregnant. And also not to, we have to say about the lifestyle of the present generation, like their work, their stress, their lifestyle, food habits, their substance abuse, everything is on the rise in the Northeast, we have seen, and that has played a huge role in contributing to this problem of infertility.
Okay, so maybe doctor, can you please explain the signs and symptoms for couples or maybe teenagers or adolescents getting into their getting into adulthood, basically, to see maybe what could be the early signs and symptoms of infertility?
Yeah, because see, when we define infertility, it is basically it's about married couples. They are trying to get pregnant for a year, but they have not been successful. So that's when we label a couple as infertility. And when you talk about symptoms, certain ladies, you will see that young children, also young adolescent girls also, if they are suffering from irregular menstruation or painful menstruation, white discharge, itching, these are things which can lead to pelvic infection. Basically, they are signs of pelvic infection, and we have seen that pelvic infection is a major cause of tubal block. And tube block leads to infertility. Irregular menstruation can be a sign of a condition, hormonal imbalance called PCOD. And painful periods of a disease called endometriosis. So any young girl who is suffering from these problems, I think they should get treated and be checked by a doctor at the earlier. So later on, they can be conscious and they are prone for infertility after they get married in later life. So these are some symptoms they should consult a doctor, the young kids. Yeah.
Okay. So maybe, doctor, can you please explain also when is the time frame as to when a couple after they're trying to get pregnant, what is the time duration that they should wait to consult a doctor? Or do you think they should do it as soon as possible?
Yeah. Yeah, no. Because we always tell, like, it's normal. Pregnancy is a natural thing that God has given us. So we have to try at least regularly every month for a minimum of 1 year. So if you are not being able to conceive after 1 year of trying regularly, then you have to be worried, especially in couples where the woman is less than 30 years. But if the woman is more than 30 years, they should approach a doctor much earlier. And I told you about the symptoms.
Okay.
Those women, like if they are suffering from menstrual problems or pain, irregular bleeding, so they have to consult. They don't have to wait for 1 year. They can consult a doctor as soon as possible. But basically, if you
Okay.
say that if everything is normal between the couple, then 1 year is the deadline basically. That the warning
Okay.
bells should start ringing. Yeah.
All right. So, doctor, can you please give us a brief regarding the kind of the various treatments that are available for such couples seeking to get pregnant?
Okay, but basically, before going towards to the treatment procedures, which are or the treatment options that are available, we have to, whenever a couple approaches us, we have to, do a full evaluation of the couple. It's not just the woman; it's both the man and the woman who have to come to us together, and we have to evaluate both of them. Basically, we do the evaluation of the ovarian reserve of the woman, her tubal status, whether her tubes are open or not. These are the basic tests that we do together with some hormonal tests. And for the men, it is the semen analysis. Look at his sperm count, motility, and everything. So, looking at those tests, we basically come to a diagnosis. So, what is the cause of infertility in this couple? So, after knowing the cause of infertility, then only we have to proceed to a definitive treatment. Every
Okay.
couple doesn't need the same. Every couple we have to treat differently. And for us,
All
when
right.
we treat these couples, we play we pay a lot of attention on counseling of these couples, basically. So counseling will start from, like, how they are trying, if they are trying regularly, about menstrual history, about their lifestyle, whether they are sleeping well, they are eating well. If they are obese, they have to lose some weight. So lifestyle counseling about lifestyle. If they are smoking too much or like too much into alcohol, so we have to counsel them about their lifestyle and about what they should do to help them, maybe with a little bit of counseling and about following a healthy lifestyle, they might be able to conceive without any treatment also. So we have seen such
Okay.
couples. Yeah.
So maybe an
So
adjust in the lifestyle.
counseling we
And
play.
habits.
The lifestyle is very, very important nowadays in, treating infertility, because
Yeah.
it's no point treating a woman who is too obese, because the success rate in this woman will be less. If the husband is smoking too much, then the semen quality will not be up to mark, and even if we treat, we will not get the expected results. So
Okay.
we do counseling about lifestyle because we want to prepare both uh, both the husband and the wife, about how to prepare their body and their mind emotionally, because if they are not being able to conceive for 2, 3, 4 years. We have couples who are not being able to conceive for 14 years. So you can imagine the emotional turmoil, the stress that they are going through. So we do not only counseling for we focus a lot on their mental health also. Try to
Yes.
boost their morale, try to motivate them, and prepare them physically as well as emotionally, mentally for the treatment, because that is very important. They are not
Yeah.
prepared. won't be able to take the treatment properly. So, and
Okay.
when we are doing yoga, meditation, that plays a huge role in the success of any kind of treatment that we give.
Yeah. Because
So,
I
like
feel
when I
a lot of
said
the
about the treatments that we give, the first is counseling, and then there are certain, after we have found the cause, if it's a case of PCOD. PCOD is simple lifestyle modification, weight reduction, diet. It's like 70% of couples just conceive that way. Suppose the
okay.
woman has fibroids. If you treat the fibroid, then without any treatment, after the surgery, the woman can become pregnant. If their woman is
All right.
suffering from endometriosis, suppose. So endometriosis is a very it's a very enigmatic and a very quiet kind of disease, but it causes severe pain during periods, and we have to treat these patients very, very carefully and on time, because it's a progressive disease. This disease
Yeah.
progresses with time, so we should not waste too much of time in patients who are suffering from endometriosis. You must have heard about the word chocolate cyst. Chocolate cyst is a very common term that we come to hear of now. So those patients should not waste time. They should leave aside their career and they can do it later on. But then they should focus on, if they are planning to start family, they should start immediately. Uh, so,
Okay.
uh, so with just simple surgery, with simple medicines, like if you have a thyroid problem, suppose you treat your thyroid issue and then you can become pregnant. And
Okay.
there's one more treatment procedure which is called intrauterine insemination. So if you have tried naturally with all the treatments that I have told you just now, and not being able to conceive, and those patients who have mild endometriosis or mild male factor infertility, or we must have seen certain couples where we have done all the tests and the tubes are okay, her eggs are okay, the husband's semen is also okay. And what? So the patients, they question us, like, we are normal, everything is normal, our hormone profile is also normal, but why aren't we being able to conceive? So that is a quite a difficult situation. Those cases we label as, unexplained infertility. You don't find any
Okay.
cause. So in unexplained infertility, the treatment modality that I have told you, intrauterine insemination, or IUI. So that it's a
Okay.
very simple process. It's a natural process. It's less expensive. It's not too invasive. So that really has good success rates in this kind of couples. That is IUI or intrauterine insemination. That's not
All
IVF.
right.
IUI is not IVF.
Okay. Okay, so doctor, I'm so glad that you brought the point of counseling also into one of your services, because a lot of people, a lot of couples actually who are not able to conceive have some sort of it has a mental effect, because they're afraid that my body can't perform the normal function that it has to. Like, as a woman, I'm supposed to conceive and give birth. That's my natural bodily process that is supposed to happen. But eventually, be it the man or a woman, it affects them. So yeah, I feel
Yes, absolutely.
counseling as a service is very necessary in such situations. So doctor, can you please
Yeah.
tell me what is the process of getting an IVF treatment?
Like you see, like I told you, IVF is not required for everybody. In
Yes.
the treatment of infertility, a lot of people say, if you are suffering from infertility, people think that, okay, I'm going to need IVF now. But like I've told you, like, that's the last option, because before going to IVF, there are many other options which are available.
Option.
So for IVF, the couples who are going to benefit from IVF is, number one, tubal block. So if the
Okay.
woman is suffering from both the tubes are blocked, a bilateral tube block, that is the indication. That was the first indication for which IVF was done in the world. The first test tube baby in the world, in UK, was born, and IVF was done in that case because of tube block. So tube block is one indication where IVF works wonders. Then second
Okay.
is, if you have done 3-4 IUIs or intrauterine examinations and you have failed. So in those cases, IVF helps you. If the woman's age is the higher side, like her ovarian reserve is less and she is more than 35, 37 years, and we have eggs are coming down, in those cases, IVF really helps. And in severe endometriosis, IVF has a very, very big role to play. And not to forget, in male factor, if the husband is suffering from severe male factor, where the sperm count and the sperm motility is very, very low. And in some cases, we see that husband's semen has no sperms. That is a nil sperm count. So in those cases, IVF helps. And when I say about nil sperm count, like azoospermia in the male, there is another procedure called ICSI, or intracytoplasmic sperm injection. That procedure, it works wonders in males suffering from azoospermia, basically. So there is a huge hope for such males. And it's just about, the couples to be aware of the different modalities that are available for them, then just to go straight to IVF or ICSI. So before going to IVF or ICSI, they can, first evaluate themselves, or what are they suffering from actually. And sometimes very simple, non-invasive, less expensive procedures might really give them good results before they take the final plunge to IVF.
Okay. So, doctor, a lot of couples are also apprehensive of seeking help or treatment due to, the cost factor, the financial factor. Can you give us an insight of how much would it cost for a couple to seek treatment?
See, because when you investigate a couple, like you have to, when you investigate the ovaries or you do an ultrasound, then you do the tube test, the basic hormonal analysis, and the semen analysis. Sometimes we have to do a DNA fragmentation index. So the total cost for doing the investigations is not more than 15,000, 20,000. Okay, so to get to the diagnosis. And then if you talk about IUI, it is not more than 18 to 20,000 with the tablets and the injections that are required to do the IUI procedure. And regarding IVF, the cost will depend upon from couple to couple, basically, because it depends upon the type of injections you are using in those patients, especially the woman, which is called ovarian stimulation. But in our center, again, the cost varies from center to center. But in our center, if we do one cycle with the stimulation injections and the ultrasounds and the egg retrievals, I can tell you about the IVF procedure after some time. But there's a procedure called egg retrieval in IVF where you take out the eggs from the woman's body. So everything included, it comes to around 160,000, maximum 170,000. So that includes all the injections. So it's slightly expensive, but then the success rates to IUI, which we do, we have a success rate of almost 60 to 70% in our center, which is at par global standards. Yeah.
All right. So, doctor, for the viewers listening and watching us right now, in case they want to avail the facilities or have a consultation, where would they possibly find you, or where would you be located at?
Right now to next Thursday, I'll be available in Elsa Clinic. I'll be available every maybe the last Friday or Thursday of every month. Once a month, I'll be available in Elsa Clinic. But if they want to come to Guwahati, then I'll be available in Arbor Vitae IVF, which is located at Dispur Last Gate. And I'm also available in Dispur IVF and Fertility Clinic, which is here very close by. It's in Ganeshguri, Dispur.
Okay.
And
so, doctor, can you?
I can share my number with you also.
All right.
On the side. I can number with you.
All right. Ezra is in Limekra, doctor, if I'm not mistaken. Your clinic. Ezra clinic is in Limekra, if I'm not mistaken.
Elsa is in Limekra, yeah.
Yes.
It's opposite Elsa Medical, yeah. It's near Nazareth Hospital.
Okay.
I'll
So,
be
doctor,
available once a month.
All right. So, doctor, any tips for our viewers and listener to avoid such cases of infertility, or maybe if they are going through it, what kind of message or advice would you give them?
See, like if a woman, they have to be very, very sensitive to, like, the signs and symptoms, like you told. So since a very young age, they have to be very careful about like how their menstrual cycles are. They should not consider it normal. Like, if you're having menstrual pain, or if you are having white discharge, itching, or if you are having heavy bleeding, or you are not having periods altogether for 2-3 months. So you have to tell your parents, and even if you're not married now, you should consult the doctor early, because you might be suffering from gynecological issue, which might be a cause of infertility later on in life. And after you get married, suppose after you get married and you are trying to conceive, a fertility consultant straight away. And because you should not waste time, especially for a woman, because like I've told you, after 30 years, it's very difficult for a woman to have a baby. It becomes difficult. You won't get pregnant so easily. So it's mandatory that after 30, you should try to conceive early, because if you take any sort of treatment early, make an early diagnosis, take early treatment, your success rates will also be higher, and your time to pregnancy will be lesser. So if you seek a doctor after 5, 6, 7, 10 years, then your age have also passed, and now you are coming for IUI, IVF. It has been seen that the success rates of such treatments will come. So what I want to say to all the couples who are suffering from this problem is to come out and accept the fact that they are suffering from a problem, and approach a doctor on time, so that they can get the best possible result and success rate. So that is very important. We are in our society, you see, the women especially, they don't like coming out and taking help. They wait for years altogether. So timely treatment is very, very important. Timely diagnosis and treatment. That is the message I would like to give to all the couples.
So, doctor, apart from timely treatment and diagnosis, there are also some certain lifestyle habits that we need to get rid of. Can you name a few that could possibly affect or lead to such? Yeah, like maybe what can we possibly cut off or avoid?
Habits is basically, I would say that you have to take a very, very healthy diet. If you can take out some junk food from your diet, that will work wonders for you. Like I always stress on a low carb and a high protein diet, lot of fruits and vegetables, cut down on sugar. You have to exercise regularly, at least 30 to 45 minutes, 5 times a week. That applies to both the partners. The husband should stop smoking, substance abuse, alcohol. The woman also sometimes, we have seen a lot of women smokers now. They should cut down on smoking, alcohol. And both of them will have to try to lose some weight. So because having the optimal body weight is very important in the success of IVF treatment. And reduce the stress levels. It's easier said than done to say that now no, you can't take stress. So there are ways to reduce your stress levels. You exercise, the least 7 hours of sleep. 7 hours of sleep is very, very important to reduce your stress and to give some time to your body to heal itself and to distress yourself. That is very important. and just prepare your body, mind, and soul. So for infertility, and we have seen the patients who are very, very positive, and very positive about, and like, very healthy, very fit, and very positive about, about life, and like when they start the treatment on a positive note, we have seen that those couples have better results and faster time to pregnancy. Actually, they don't take much time to conceive. We are preparing patients for IVF with lifestyle and all. We have seen that couples who have not conceived for 5, 6, 7 years, just with simple lifestyle and like, proper sleep, proper diet, exercise, they have just conceived while they were waiting for IVF. So these are all very positive things, and these things do happen when we see patients. So that is very positive.
Okay. So, Doctor, before we conclude today's discussion, do you have any closing remarks or a message to the viewers and listeners?
Like, again, I'll repeat myself. Please come out and meet your doctor, a fertility consultant, if you are having difficulty in having a baby, and get yourself diagnosed early, and so that you can start your treatment on time, and this will help you get better success rates, whether you do simple counseling or you do IUI, IVF, ICSI. So just do the treatment on time, because if you do start your treatment later in life, then like if you are 37 plus, 38 plus, the success rates go down. So please come out and take treatment on time. That's the only message. And take care of your health. Be positive and just pray. I am definitely sure you are going to have a positive result. Just stay positive. So that makes a huge difference. Hello, I can hear you.
Hello, Doctor, can you hear me?
I'm not being able
Hello?
to. Hello, I can hear you now.
Am I audible?
Yeah. You
Okay.
are.
So, a viewer has commented that his wife has a high BP. Will it affect pregnancy?
Yes, because if you are suffering from BP, high BP or hypertension, you have to control your high blood pressure before you plan pregnancy with appropriate medications. You have to understand that all antihypertensives are not safe in pregnancy. So there are certain BP medicines or antihypertensives which are safe in pregnancy. If you can control your high blood pressure during pregnancy, definitely there'll be no side effects. But then there is a condition called pregnancy induced hypertension, which develops after 20 weeks of pregnancy, that is after 5 months of pregnancy. So that is inevitable basically, but then there are medicines with which you can control it. If you can't control it, then there can be side effects on both the mother and the baby. Okay, so regarding baby, there's a chance that the growth of the baby might be less. The liquor volume, the water in which the baby stays in the whole of the 9 months, that can reduce. The growth of the baby can reduce, and we have seen that sometimes the baby can die inside the uterus also. So you have to be in touch with the doctor regularly and control your BP regularly. And regarding the mother, there is a chance that if the BP is very high, her legs might get swollen, it might affect her lungs, and it can affect her brain also. So high BP is slightly dangerous, and you have to be in consultation with your gynecologist as well as a very, very good cardiologist. So then you can have a safe delivery. You can control your BP pregnancy. And if you can't uh, control with medicines, then you have to plan to deliver the baby earlier than, sometimes much, much earlier than her due date. That also sometimes is, we might have to do to save both the mother and the baby.
Okay.
Yeah.
All right. So, Doctor, we'll wait for a few more comments. Okay, there it is. What are the resources or counseling services that you offer to help couples cope with the emotional demands of IVF?
Yeah, because see, whenever a couple comes to us, like I am to always there to counsel the couple, but every IVF center actually that we have has to have designated counselors. So after I see the patient or I meet the patient, then we send them to a counselor to know what problems are they suffering from, especially the mental health issues, and to create that positivity in their mind that there is a way out for them. There is a way out of this problem for them, and infertility is not a hopeless situation. So if you take treatment, the appropriate treatment at the appropriate time. So these kind of, and we counsel them about diet, exercise, and everything, try to create the positivity in them. So we have counselors in our centers who do that for them.
Yeah, I see a lot of couples accepting infertility as faith and they just give up, and which is a really sad thing. So I'm really glad to have you on board, doctor,
They should
shedding
not
light
give
on.
up without finding out the cause.
Yeah.
Yeah. They should not give up before at least trying to find out what is the reason for not being able to conceive. So at least take some initial basic treatment counseling. I think that will go a long way in preparing them and to make them
Yes.
accept this is because not every couple suffers from this problem. Like I said, 1 in 7 will only suffer from this, but there is some, like you said, there's a ray of hope in everything,
Yes.
and especially in infertility, there's a way out.
Okay. Another question, doctor. What kind of food should a pregnant woman take? The diet.
Yeah, you should. Yeah, you should take a balanced diet. It's not that once you become pregnant money, you are going to take, you have to take double the amount that you were taking when you were not pregnant. You have to make sure that you take, like I said, you take a high protein diet, as in fish, meat, eggs, milk products, lot of fruits, lot of vegetables, especially dry fruits. And if you are, having PCOD, or if sometimes we get pregnant mothers who are diabetic or who develop diabetes during pregnancy, those patients should especially avoid sweets and simple carbs. And you have to take a lot of water, at least 2 to 3 liters of water daily. Rest,
Okay.
and you can continue your minimum walking, exercise, and yoga. You can continue during pregnancy. It's all about high protein, and we also supplement from the third month. It is important that although you take a healthy diet, it is important from the third month you have to supplement yourself with additional iron and calcium tablets, because the diet
Okay.
that you are taking is not sufficient. However much you take, you cannot suffice for the extra calcium, iron, and the folic acid. So you have to take those supplementation during pregnancy. So that is very
Okay.
important. Don't eat,
Okay.
don't eat a lot. You take small, frequent meals, spread it out over 5 meals a day. Just try to eat healthy and a balanced
All
diet.
right. Okay. This is for our viewers and listeners. If you have any comments or questions you have for our doctor, please go ahead and comment. We will be answering a few. I think we got another comment, doctor. How do you stay up to date with the latest IVF research and developments, and how do you incorporate this knowledge into your practices?
Oh, how do you incorporate this knowledge into your practice? Okay, for us, doctor, it's not only about IVF, it's about all doctors. It's all about all doctors that we have to keep ourselves abreast with all the latest developments which are happening in the medical field. And this is called continuing medical education, because we have, we pass out of medical school and do our post graduation, and things have changed a lot over these years since I have passed out. And we have these CME programs, seminars almost every 15 days, and we have national and international conferences which are happening every year. So we have this conference called ISAR and IFS, and then we have these two very good conferences called your ASHRAE and ASRM. So these are the conferences we have to, as IVF specialists, or any other as IVF specialists, we have to attend, and we learn, we share our experiences as well on the national as well as international platform. And you have to incorporate the latest in your practice. So it is important. The things have changed. When IVF had started, the success rates were not this high. The initial success rate of IVF was just 10, 15, 20% when it started. But over the years, the IVF success rate has come up to 60%, 70%, like that. I want to say that IVF is never 100% successful in the first attempt. You might require a second or a third attempt. But this science has progressed so much, it has advanced so much. IVF, which was at 15-20% success rate, now it is at 60-70% success rate all across the globe. So it is like that. So definitely things have progressed. We have learned so many things along the way, and hopefully in the coming years, you don't know that IVF can become, at least 100%, not 100% successful, maybe 80-90% success is possible, because it has been happening. It's a very dynamic subject. A lot of research, a lot of developments have taken place in the last 15 years. I have been doing this practice. I have myself seen the development which has been taking place in this, the research, the development which has been taking place in the field of reproductive medicine. So a lot of genetic tests and a lot of other procedures like PICSI, NIPGS, PGTA, all these have contributed a long way to improve the IVF success rates. ERA, there are many procedures which have come along with IVF and ICSI to improve its success rates.
Okay. Thank you so much, Doctor. I think with that, we won't be answering any more comments. In case any of the viewers and listeners wants to have a consultation with Doctor, like she said, she will be available in Guwahati or either in Limekrat. Thank you so much for joining us today and for this insightful conversation. This is a topic that is mostly not talked about, and a lot of couples remain in the dark or accept their faith, so they say, when it comes to infertility. So thank you so much, Doctor, for shedding light on this very important issue. It was a great honor. It was an honor to have you here, and I hope that the viewers and the listeners to this program has gained valuable insights from you, Doctor. Thank you so much.
Thank you so much. It was my pleasure, and thank you once again. Thank you.
Thank you.